If you're unvaccinated and you're listening to me, and we do have some great affiliates in Washington State, that is, and you would like some free joints, well, guess what? Licensed marijuana stores in Washington State can offer free joints to promote on-site COVID-19 vaccine clinics. That was announced at the beginning of the week. Who better to have on with us than somebody who's right out there on the West Coast, Paul Siegert, and he is a managing partner for PCS Advisers. As I said, he's all things healthcare. He's an employee healthcare benefits consultant in a firm based in Northern California, very, very close to those people in Washington. Hey, Paul, how are you?
Doing great. How are you, Kate?
Good. What do you make of this? Is it just like, hey, look at how much money is going out the door with these lotteries in California, in Ohio, and other states? I mean, we've seen free sports tickets, lots of that prize money I mentioned. So why not marijuana? Is that kind of the attitude, do you think, with this one?
I think so. Why not try it? See if we'll do anything at this point to sell these vaccines, because I think we've made it through most of the population that really were eager to get vaccinated, and even part of the population that wasn't sure have gotten on board. So now we're getting to that tougher group that, where this may or may not have much of a real effect on it.
Yeah, that's the question. Will it have an effect? I mean, being in radio, listen, and I was in television news, and if you had any kind of a giveaway, it didn't matter what you were giving away, Paul. People would line up, they would sign things, send things in, make wacky stories, do whatever they had to do. So you could give away anything. It's kind of along those same lines, like, hey, this is more valuable than anything, so why not put that up there? Do you think in the end, though, that really works with the age group of who they're trying to get, which is really the Z generation, I think, and I guess millennials, and what do you think?
Well, what we've seen in some of the polling is that, and there is something different here, because they're saying if you get the vaccine on site, we'll give you a joint, versus some of the other lotteries and stuff that say if you've been vaccinated, you're included. So it could have been that they're just going to reward people that were already early adopters.
Yeah.
So maybe they've got a little bit of a better chance, and perhaps this is a good way to target that group that is holding out a bit. But we also, interestingly, we see when people are polled that it kind of follows along political lines, party lines, as to what motivates them. If you're more conservatively minded, the idea of getting your freedoms back is very motivating. And so I think in lots of cases, we've kind of hurt ourselves in our messaging and our mixed messaging when we've told our population, get a vaccine and do these things, and maybe we'll return to normal. It's looking more like we are returning to normal now, and that's good news for everybody. But on the more liberal side of things, there is more, at least the polling indicates, that this is more motivating. And it's a pretty left-leaning state, so, it could be that they do move a few more points toward getting vaccinated. They are already ahead of the nation. They're at 48%. Let's see, 48% versus 42%. The rest of the nation's 42% fully vaccinated. They're at 48. And so they're already ahead. And single doses, they're at 58, where the rest of the country's at 51. So it'll be interesting to see what happens there. I don't think it's going to be a big swing.
Yeah, it doesn't feel like it's going to be a big swing to me either. I love your point about mixed messaging. It's so important, as you know, with anything healthcare related, that once you get it out there, once you're talking about whatever it is, especially a pandemic that we've been in, if you turn and reverse and flip-flop on things, that's when it doesn't matter, I think, Democrat, Republican, Independent. People start to say, well, wait a minute, first we heard this and then we heard that. And I think that was kind of the problem with this all along. Do you?
I totally agree, and I hope we'll learn from that. This is an age where we all have a smartphone, and we can look things up. I mean, we can look up research from the CDC that often has kind of countered what we were hearing in the media, even from folks from the CDC or other, national experts and appointed experts. So we've done a bad job there, and that cost us, I think, quite a bit of time. And we're already a vaccine-hesitant population. About 30% of Americans say, I don't want to get vaccinated for anything. And we've gotten this down to about one in four. So with all the media campaigns and everything else, we've made some headway there. But we worked against ourselves for sure.
And no way 70%, right? You just were talking about the numbers that Washington State was ahead. But if you look at 51% for 2 doses fully vaccinated, let's say that just goes up a little bit. Biden was calling for 70%. We keep hearing that 70% as the eureka moment. I don't think we hit that by July 4th. Do you?
No. And I think this brings up a really good point, too. We've had mixed messaging. We've had bad messaging, and we've had messaging that, and we've lacked certain messaging, some of the facts. I mean, we know all the studies are showing, you look at places like Italy that were the hardest hit and earliest hardest hit, those who got COVID, even mild cases, have antibodies and have immunity and aren't having breakthrough infections at any higher a rate than those who get vaccinated. So if you've had COVID, you have immunity. And while some say, sure, we don't know how long that immunity will last, every study, for as long as this has been going on, continues to confirm that the immunity is there. So, which is as much as we know for the vaccines, frankly. So we've kind of missed that whole point, and we were told 70 to 90% would be herd immunity. And when you look, the CDC's own research shows that 8 times more, and they're some of the most conservative when looking at this, 8 times more Americans have had COVID that have been confirmed to have had COVID. And I looked at it today, and our confirmed cases are north of 33 million. So if you take that 33 million, multiply it by 8, and get yourself around, let's call it 267, plus the 33, you're at 300. That's the 90% number. The 70 to 90 was the range we were given for herd immunity. I mean, it was a moving target. But even if we go to that higher end, that 90%, that would indicate we're there. And so would we're not talking in the media much about hospitalizations and hospitals being overrun and in deaths anymore, because all the indicators have fallen in a good way. And I think we can afford to be optimistic. We should be optimistic when the facts say that we should.
Yeah. Boy, I so agree with that. Paul, it's always great to have you on the show. You offer such great insights. Thank you so much for coming on.
Thanks for having me.
Yeah, that's Paul Siegert. And like I said, you can look him up pretty easy. Go to PCS Advisers.com.